Are you tired of that shooting pain running down your leg? That tingling, numbness, or weakness that just won't go away? You might be dealing with sciatica, and you're definitely not alone. Millions of people experience this, and the good news is, there's a lot you can do about it right from the comfort of your home. So, what exactly is sciatica? It's not a condition itself, but a symptom. It happens when the sciatic nerve, which is the longest nerve in your body, gets irritated or compressed. This nerve starts in your lower back, goes through your hips and buttocks, and runs down each leg. When something presses on it, like a herniated disc or a bone spur, it sends pain signals all the way down its path. That's why you feel it in your leg, not just your back. The symptoms can vary a lot from person to person. For some, it's a mild, annoying ache. For others, it can be a sharp, burning sensation, or even feel like an electric shock. The pain is almost always on one side of your body. You might feel it anywhere along the nerve pathway, your lower back, buttock, the back of your thigh, and your calf. Sometimes it even reaches your foot and toes. You might also experience numbness, tingling, or muscle weakness in the affected leg. The pain can get worse when you sit for a long time, when you stand up, or when you cough or sneeze. It can make simple things like walking or finding a comfortable sleeping position a real challenge. Now, let's talk about what you can do at home to find some relief. Remember, while these tips can be very helpful, it is always a good idea to check with a doctor or physical therapist to get a proper diagnosis and personalized advice. First up, let's discuss gentle movement and stretching. It might seem counterintuitive to move when you're in pain, but staying still can actually make things worse. Gentle activity is key. One of the most effective stretches for sciatica is the knee-to-chest stretch. Lie on your back with your knees bent and feet flat on the floor. Gently bring one knee up towards your chest, holding it with your hands for about 30 seconds. You should feel a comfortable stretch in your lower back and buttock. Repeat this a few times on each side. Another great one is the piriformis stretch. The piriformis is a small muscle deep in your buttocks that can sometimes spasm and press on the sciatic nerve. To stretch it, lie on your back with your knees bent. Cross the ankle of your painful leg over the opposite knee, creating a figure for shape. Then, gently pull the uncrossed thigh towards your chest until you feel a stretch in your buttock. Hold for 30 seconds and repeat on the other side, even if it's not painful, to maintain balance. Consistency is key with these stretches. Try to do them daily, but never push into sharp pain. A gentle pull is what you're aiming for. Next, let's talk about hot and cold therapy. This is a simple but effective way to manage pain. When the pain first flares up, using a cold pack can help reduce inflammation and numb the area, providing immediate relief. Wrap an ice pack or a bag of frozen veggies in a thin towel and apply it to the painful area for about 15 to 20 minutes at a time, several times a day. After the first few days of acute pain, you can switch to heat. A heating pad or a warm bath can help relax tight muscles that might be contributing to the problem. The warmth increases blood flow to the area, which promotes healing. Some people find that alternating between hot and cold provides the most relief. Experiment and see what works best for you. Your posture also plays a huge role in managing sciatica. Poor posture, especially when sitting, can put a lot of pressure on your lower back and aggravate the sciatic nerve. If you work at a desk, make sure your chair provides good lumbar support. Your feet should be flat on the floor, and your knees should be at a 90-degree angle. Try to get up and walk around every 30 minutes to an hour. When you're standing, try to keep your weight evenly distributed on both feet. When you lift something, always bend at your knees, net your waist, and keep your back straight. These small adjustments throughout your day can make a big difference in reducing the strain on your spine. Strengthening your core is another crucial step. Your core muscles, the muscles in your abdomen and back, act like a natural corset for your spine. When they're strong, they provide support and stability, taking pressure off your lower back and the sciatic nerve. Simple exercises like the plank and the bird dog are excellent for building core strength without straining your back. For the bird dog, start on your hands and knees. Keep your back flat as you extend one arm straight out in front of you and the opposite leg straight back behind you. Hold for a few seconds, then slowly return to the starting position and switch sides. The key is to keep your core engaged and avoid arching your back. Over-the-counter pain relievers can also be helpful for short-term relief. Non-steroidal anti-inflammatory drugs, or NSAIDs, can help reduce both pain and inflammation. However, it's important not to rely on them long-term and to use them as directed. They are told to help you manage the pain so you can stay active and do your stretches, which are the real long-term solutions. Always talk to your pharmacist or doctor before starting any new medication to make sure it is safe for you. Let's also consider your sleeping position. Sleeping can be difficult with sciatica, but the right position can help. Try sleeping on your back with a pillow under your knees. This helps maintain the natural curve of your spine and reduces pressure on your lower back. If you're a side sleeper, sleep on your non-painful side and place a pillow between your knees. This keeps your hips, pelvis, and spine in better alignment. Avoid sleeping on your stomach, as this can flatten the natural curve of your spine and strain your neck. While these home treatments can be very effective, it's vital to know when to see a professional. If your pain is severe, getting worse, or doesn't improve after a few weeks of self-care, it's time to see a doctor. You should seek immediate medical attention if you experience weakness or numbness in your leg that is progressing, or if you have trouble controlling your bladder or bowels. These could be signs of a more serious condition that requires urgent care. A doctor can give you a proper diagnosis and may recommend physical therapy, prescription medications, or other treatments. To recap, managing sciatica at home is all about a combination of gentle movement, targeted stretching, smart use of hot and cold therapy, improving your posture, and strengthening your core. The knee to chest stretch and the piriformis stretch are your best friends. Remember to listen to your body and never push through sharp pain. Small, consistent efforts can lead to significant relief over time. It's about empowering yourself with the right knowledge and tools to take control of your pain. You have the power to feel better, and it starts with these simple steps. Thank you so much for watching. I hope these tips help you find some relief from your sciatica pain. If you found this video helpful, please give it a thumbs up and consider subscribing for more health and wellness content. Don't forget to share it with anyone you know who might be struggling with similar pain. Take care of yourself, and we'll see you in the next video.